So we're having a classic car show and men's brain health fair combined for the first time here at Rutgers-University Newark. And the purpose is to reach out to men who traditionally don't come to health education events. We've been working for the last 12 years to bring health education to older members of the African-American community at Newark. And by and large, we've gotten about 90–95% of the people who show up are women. We think that the way we can begin to lure the men out is to combine these health education with something else. In this case, it's classic cars.
The initiative was started because we know that in the African-American community that there is Alzheimer's, and it's a high level of it. And we know that that community did not have a real understanding of what it is and how to respond to it.
A lot of men tend to wait until there is a problem. When they have pain, that's when they start to try to find help. But the reality, there are things that are not painful. Take high blood pressure, for example. You don't know if your blood pressure is high unless you go ahead and have the blood pressure checked.
The other thing we're doing is working with the local churches with their men's ministries.
There's a lot of the fellas within the community that are interested in old cars, new cars. They have mechanical inclinations. So we use a little trickery, like the car show here, and then say, okay, well, look here, there's a doctor over there. Why don't you go get a blood pressure exam? Something very simple as that to get them started.
I think what's important about brain health is, number one, knowledge is important. And how do we get that information into the communities is what's going to be the biggest challenge of all. Because once you know, you can do something. If you don't know, you just don't know.